Welcome back. Confusion and overwhelming criticism in the scientific community over President Trump's announcement yesterday that acetaminophen is linked to autism. The American College of Obstetricians and Gynecologists swiftly replied to the president, reaffirming the long recommendation that acetaminophen is a safe option during pregnancy. There's a lot of confusion here, and we want to try to break through some of that now. So joining us is physician Dr. Omer Awan. He's also a senior public health contributor for Forbes. Thanks for coming back with us today, Dr. Awan. So you and I talked just before last night's announcement from the White House. You told me you were going to pay close attention to who said what. So let's play a little bit of a soundbite, a clip here for you, and get your response on the other side.
Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born.
Okay, so what's your reaction, Dr. Awan?
Disheartening, Maritsa, very disheartening, because this is the president of the United States, the most influential person in the world. It's telling us something that is really not backed by scientific evidence. There is no conclusive scientific evidence to suggest that Tylenol causes autism. Decades of research has shown it to be very safe and effective. So I believe what this does is this causes, as you have already stated, this causes a lot of fear and confusion amongst pregnant women. That's what this does, because we don't have a lot of alternatives. People take Tylenol. It tends to be very safe. And now you will have many pregnant women question whether or not they need to take it. And this can have devastating consequences, because if people and patients have a fever or they have pain, they may be reluctant to take it, and it can actually cause more harm than good. You know, we know that an untreated fever can result in things like a miscarriage or preterm birth. We know that untreated pain can result in things like depression, anxiety, even high blood pressure in a pregnant woman. So very concerning that this announcement was made, how it was made, the strength of which it was made, and just the rippling effects that may occur in the next several years because of this announcement.
Yeah, and I know, I mean, when I was pregnant, I took Zofran for morning sickness, and there was a risk there associated, but I wasn't able to get through the days. And there's a cost-benefit analysis of doing anything when you're pregnant. I mean, there are so many rules about what you should and shouldn't do that it becomes overwhelming and it becomes confusing. Now, the president said that women should talk to their doctors. And then in another sentence, he said that they should fight like hell not to take it. So what does that do to the messaging here? And what are you hearing? Are you hearing from patients today?
The messaging is not clear, first of all. And this is a problem with the Trump administration, unfortunately, which is what we've seen for the last 8 or 9 months with respect to messaging. You know, one thing is said and then another thing is said. You know, even if we take a look at vaccines, for example, you know, the CDC had said that pregnancy was a clear risk factor for COVID. And then Secretary Kennedy later said that pregnant women would not be able to get the vaccine. So you can see that this unclear messaging is casting a lot of doubt, but also confusion amongst people. And this is a problem. This is the problem. I don't know how else to say it. You know, people will doubt some of these things. A very clear, safe, and effective medication that should clearly be used may not be used. I mean, I'm a father of 4 kids, small kids. My wife took Tylenol in pregnancy. I can't imagine if she didn't take Tylenol for pain. We have 4 kids. None of them have autism. And I want to share that. I usually don't share my personal history, but I want people to understand that it is a safe and effective drug. And if you have pain, take Tylenol. And more importantly, talk to your OB/GYN. That's the moral of the story here. The moral of the story here, and President Trump also said this. He said, talk to your physician. I think it's funny that, you know, if we were to have an issue with our teeth, we wouldn't go and talk to our financial advisor. We would go to a dentist. If we had an issue with our car, we wouldn't talk to anyone on the street. We would go to a car mechanic or a car dealership. The same is true for your health. You shouldn't talk to a politician, you should talk to a physician. I think a physician will give you the best advice for how to treat yourself and be well.
I want to talk about some of the responses to the language that was used around autism in yesterday's news conference. I saw advocates like Tim Shriver, who's the chairman of Special Olympics International, say, we need to be really careful not to stigmatize people with autism here when we're talking about this. A spokesperson for the Autistic Self-Advocacy Network said that the way Secretary Kennedy speaks about autism is dehumanizing. So what should we all be considering here when it comes to being thoughtful in these discussions?
Well, it's a real disease, right? And it's a real condition, I should say. And yes, I also agree that, it was dehumanized to some extent. We focus on it as a problem, and it's not necessarily a problem. I mean, there are beautiful kids that have autism and they flourish, right? They learn and they're contributing positively to society. It shouldn't be seen as a problem. We should reframe autism as something that people live with and that people grow with and that people understand, and people are living just like others are living with other conditions. This is how we should think about autism. Beautiful people in the world have autism, and they have contributed very positively and significantly to society. And I suspect that will continue to happen. To stigmatize it and to dehumanize people is never the right solution. We are here as advocates for our patients. We're always trying to promote them, and we always want to do well. And I think that's the message that people should really hear and understand.
Dr. Awan, I want to ask you too about some of the other claims that the president made. I mean, he came out and he said he's speaking for himself. These are his thoughts, his opinions, that he's not speaking on behalf of the doctors. But he made some claims about, no autism within Amish communities when they don't take vaccines, or no autism in Cuba. What's your response to those claims?
Well, some of them aren't true. And, I'm not going to speak for the Amish community, but I will speak about Cuba. It exists in Cuba, and that's a fact. That's a fact that it exists. And I'm not sure they're looking at the data very carefully. And this is, again, another problem with mistrust, not citing the data properly, cherry picking certain data to further people's agendas. And we can't do that when it comes to science and when it comes to the well-being of the American citizens. We cannot cherry pick because our health is dependent upon that. If we sit there and accept misinformation, all of us suffer. No one is winning when this happens. Republicans aren't winning, Democrats aren't winning, and the only people that are losing are the American people, because our health suffers and our health outcomes suffer. So it is critical when we talk about science and public health to stick with the facts, stick with the evidence, because that should guide public policy going forward.
Dr. Awan, I wonder your thoughts about this, because at the news conference, the president talked about evidence that was forthcoming. And we know that scientific research evolves and scientific studies evolve and conclusions. So is there room in this conversation that these claims could be true if we see more research?
Yes, absolutely. Absolutely. This is what science is all about. Science is all about innovation. It's all about changing the way we think about things. I'm totally okay with it. And I think the vast majority of physicians and scientists would be okay with it. But the claims that have been made currently are not substantiated with evidence. And is it possible that Tylenol could have an environmental effect on autism like some anti-seizure medications do? Yeah, possibly. I don't think we're there yet. But if that's true, then maybe we'll discuss that at that time. But all the decades of research that we have currently doesn't point to that. It simply just doesn't point to that. And we know that autism is a very complex condition. Interplay of hundreds of genes, environmental factors. Could Tylenol be part of this equation? Maybe, but we don't know yet. And we certainly need to do much more rigorous scientific studies before we can make such a claim. But I think part of science is also being open-minded, looking at data and being able to change your mind based on what the evidence shows us.
All right, Dr. Omer Awan, thank you so much for coming back and joining us here on Scripps News.
Thanks, Maritsa.